Can I have you confirm your initials and date of birth for me?
AS 10-1-92.
Okay, perfect. And now I'm just gonna take a look at your arms and your legs. All right, I'm just checking like the skin. It looks warm and dry, pink. Okay. And now I'm gonna take a look at your fingernails and your toes. Everything looks normal. No clubbing, no. Okay. All right, and now I'm gonna test for your skin turgor. No tenting. No edema. I'm gonna check your hair. Just looking at the distribution, looks pretty even. Thickness is good. All right, now I'm gonna check your neck out. No discoloration or anything. All right, I'm gonna palpate the temporal arteries. And then I'm gonna palpate your sinuses. Now I'm gonna check for TMJ. I'm gonna have you open your mouth and close your mouth. Okay. And then I'm gonna just palpate your lymph nodes. And then I'm gonna have you lift your arms. And then this one. Okay. Alright, and then I'm gonna check your carotid bone. Alright, and then I'm also gonna listen to the carotid. I'm gonna have you close your eyes. I'm just gonna inspect your lids. I'm gonna palpate a little. Okay, and now I'm gonna have you open your eyes back up. And then I'm gonna have you take a look at the pen light and just follow the pen light. And then I'm also gonna check your reflex. And then I'm gonna have you look at the tip of my finger and just follow it. Okay. All right, and then this, I would have the patient now do the Snellen chart test. We don't have that, so I'd have them have the Snellen chart about like 100 feet away, have them cover their one eye, and read the lowest, the smallest letters that they can, and then repeat covering the other eye. And then I'm gonna check out her ears, inspect them, palpate them. I'm gonna take the pen light and look inside. We'll do that on the other side. Everything looks good. And then I'm gonna perform a whisper test. So I'm gonna whisper 3 things to you, and then I'll have you repeat them.
3B5.
Okay, perfect. All right. Now I'm gonna check out your nose, inspect your ears, everything looks good. And then I'm gonna hold one of the nostrils, have you breathe, and then we'll repeat on the other side. Okay? Okay, and then I'm gonna check for your sense of smell. I'll have you close your eyes, and then I'm gonna put something under your nose, and you're gonna smell it. So tell me what it smells like.
Okay.
Okay. Smell.
Do I have to tell you what it smells like?
Yeah.
Tea.
Yes, perfect. Okay. I'm gonna check out the inside of your nose too. You can keep your eyes open. Okay. Everything looks good. Alright, now I'm gonna have you open your mouth. I'm gonna inspect the mucus membranes in there. Okay, and I'll have you lift your tongue up, down, and side to side. Perfect. Okay, and then I would test the gag reflex with a tongue depressor and just stroke the sides of the uvula. Okay. And now I'll inspect her neck for jugular vein distension. Everything looks okay. And then I'll check all the pulses. Okay. And then I'll go to the PMI. Okay, and I'll do alright, and I'll have you stand up and I'll check your popliteal and your femoral. Okay. Alright, and you can sit back down. Alright, and now actually I'm gonna check the heart sounds for S1 and S2. I'm actually also going to have you stand up and I'll check your renal arteries. Okay, sit down. Alright, and I'll have you hold out your fingers. I'm gonna test your Capillary refill. Looks good. Less than 3. Okay, I'll do toes too. I'm gonna hold my hands on your chest while you breathe. There's symmetric chest expansion. And I'll have you, if you could sit like kind of sideways, perfect. And then I'll have you say 99.
99.
Okay, and then I'm gonna percuss back here as well. And I'll be saying 99.
99.
Again.
99.
And
99.
again.
99.
Again.
99.
Again.
99.
And last time.
99.
Okay, so I'll have you face forward again, and then I'll percuss over here. Again with the 99.
99. 99.
I think someone.
99. 99. 99. 99.
Alright, and now I'm going to, I'll have you stand up. And this is where I would inspect the abdomen, all 4 quadrants, and then I'll listen. Right, and then I'll percuss the abdomen over the clothes in all 4 quadrants, and then I will perform light palpation. Okay, and then I'll have you turn a little, and then I'll assess for CVA tenderness. Okay. And I'll take a look now at your joints, if anything's inflamed. Okay. Alright, and then I'll have you sit back down. And then I'm now gonna test the neck range of motion. So I'll have you put your head forward, backwards, side to side. Right, and then I'll have you put your like ear to your neck, ear to your neck on the other side, and then now I'm gonna test it against strength. So try to head side to side again, and then forward, and then backward. Perfect. All right, and now I'll test for shoulder range of motion. So now you're going to flex. So I'll have you raise your arm up and then back. You can stand up for this if you, yeah, just realized that. All right, and then you can do that one, yeah. Perfect. And then I'll have you do like side to side, flapping your wings, kind of. Okay, and now I'm going to test it against resistance. So I'll have you side to side again. And then out, and then try to put them back in. Perfect. And then we'll do up and then back. Okay. Okay, perfect. And now we will do your arms. So like you can curl your arms and then back. Perfect. And then we'll just test it against resistance. Curl them and then back. Perfect. Okay. I'll have you keep standing up. And we'll do your elbows. So I'll have you have your palms out and then flip them over. Perfect. And then I'll do hand range of motion. So now I'll have you kind of put your wrists down and then up and then kind of like side to side wave them. Yeah. All right, and then I'll have you take my 2 fingers and squeeze them as hard as you can. Okay, and then I'll test through resistance. So hands up again, kind of like a, okay, and then down. Okay, perfect. And then now we'll test spine range of motion. So I'll have you like kind of like lean forward and then lean back and then like kind of like side to side with your spine. Yeah. All right, and then I'll have you like kind of twist. Awesome. All right, and then for you might want to stand a little closer because we'll do something with the legs. So now for hips, I'll have you kick kind of forward and then back. And then kick your legs back. Yeah. Yeah.
Sorry.
Okay, and then now I'll do one against resistance. You could do this one against resistance. Perfect, and then back. And then now I'll have you kind of do your leg out and then towards the middle. Yeah, you can kind of like cross them over if you need to. Perfect. Okay, and now we'll do knees. You can sit down for this one. And then I'll have you just kind of extend them and back. And then now we'll do it against resistance. Okay, perfect. All right, and now we'll do ankles. So, I mean, maybe you could probably lift your ankles up. So I'll have you put your feet up and then down. I know it's kind of hard on the floor. And then curl your toes up and then like straighten them out. Perfect. And then against resistance, I'll have you up and then down. Perfect. Okay. So now we're gonna test cranial nerves. We'll test cranial nerve 5 first. I'll have you clench your teeth hard and then move your jaw like side to side. And then I'll have you close your eyes. And then I'm gonna touch your face and you tell me if it's sharp or if it's dull.
Dull.
You wanna think about that again?
Sharp.
All right, and then tell me if it's
Dull.
yes. Okay, perfect. Okay, now we'll test for cranial nerve 7. I'll have you can open your eyes. I'll have you raise your eyebrows, frown. Shut your eyes really tight. Smile. You can open your eyes. Puff your cheeks out. Like, yeah. And then make a kissy face. Pucker. Yeah, perfect. Okay, now I'll test for cranial nerve 9, 10, and 12. I'll have you open your mouth and say ah. And then stick your tongue out. All right, awesome. Okay, so now I'll have you take your heel and then run it down the length of your shin, both sides. Perfect. And then I'll have you put your fingers to your nose. Both. Perfect. And then now I'll have you walk. You can walk like this way in a straight line. And then walk back. Yeah. All right, so now she's doing heel to toe. And then walk back, and then now you can do, once you get back here, I'll have you go walk on your toes.
In a straight line?
Yeah. Perfect. And then walk back. And then I'll have you do that again with on your heels. Perfect. Okay, and you can sit back down. And if you want to put your palms on your knees and then flip them up and flip them back and do that as fast as you can. Perfect. And then tap your feet on the ground as fast as you can. All right, perfect. And then I'll have you touch your thumb to all your fingers. Awesome. And that's rapid alternative movements. And now on your arms and legs, I'll have you close your eyes. And then you tell me if you feel sharp pain or dull pain, or not pain, but sharp or dull sensation.
Sharp. 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 Sharp.
Okay. And then you tell me what this feels like. That's sharp or dull.
Dull. Dull.
Okay, perfect. Okay, and now I'll perform the Romberg test. I'll have you stand up, and then put your heels together. Stand with your heels together, and then I'll have you close your eyes. Okay. And then now, I'll have you sit back down. And then close your eyes and put your palms out. And then you tell me what number or letter that I'm writing on your hand.
4. B.
Perfect. Okay. And now I'll test. Keep your eyes closed, and then you can tell me what object you feel in your hand. You can close your hand and feel it.
A key.
Okay, what do you think that is?
A paper clip.
Perfect. And then I'll give this one in your other hand.
A coin.
Perfect. All right. And then now you can open your eyes. Now I'm going to test your orientation. Do you know what year it is?
2022.
Yes. Do you know where you are?
Home.
Do you know who the president is?
Biden.
Yes. Okay. And then can you count backwards from 100 by sevens? Just try.
193. 86, 79, 72, 65, 58, 51, 44, 47, 38, 31.
That's good. That's good enough.
Okay.
Okay.
Oh, that's fantastic.
And if you could tell me how you celebrated your last birthday.
I went to Maine.
Okay, perfect. And then I'm gonna give you 4 words, and you're just gonna repeat them for me. So there'll be bus, cake, flower, dog.
Bus, cake, flower, dog.
Okay, and then I'll have you count backwards by 20, or count backwards from 20.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, and then if you can repeat those 4 words that I mentioned before you counted down.
Bus, cake, dog, flower.
Perfect. All right, and I want to thank you for being my patient today.
Thanks.
Thank you.